what's so interesting for me when you're speaking to cardiologists is that when people embark on this lifestyle, they are absolutely petrified. They are terrified, as you mentioned in your presentation, it goes against everything we've been told for so many years. But at the end of the day, a lot of people fail to go on this type of lifestyle because they're either told that it's going to kill them, or they're told that if they eat the fat, they're going to get a heart attack and die.
Right.
So as a cardiologist, can you try and dispel some of those myths and try and explain, why it is that we've been led to believe this way of thinking?
Right, big topic. I think that, so in general, fear comes from lack of knowledge. And with these, with a ketogenic diet, of course, or low carb, as you said, you're going completely against what you've been told for most people, unless you're younger, most of your adult life. And so the mantra has been, if you eat fat in your diet, your cholesterol is going to go up, and then you're going to develop plaque in the arteries and die. And that's kind of been the very simplistic viewpoint. And the fact of the matter is that most people really have no idea what really happens. And this includes physicians and other healthcare providers. And so not only are the patients afraid, but the physicians are afraid. They're being given bad information. And so I think the key really is sort of an understanding what actually happens to the cholesterol, to the lipids on average. And the short answer to that is that the overall cholesterol tends not to change a whole lot, or might even go down a little bit. The HDL, the so-called good cholesterol, increases, which is desirable. The triglycerides tend to go down a lot for most people. And again, this is a good thing, triglycerides being fat in the blood, but ironically, and of course if you're versed in low carbohydrate nutrition and metabolism, you realize why this would happen is that when we switch over and we're burning fat, well then we burn the fat in the blood, so it goes down. So those are all positive things. And then on average, the LDL cholesterol tends not to change a whole lot. It may go up just a little bit on average, but not much of a change. So knowing that, once somebody knows that and understands it, then that can take a lot of the fear away, because then you realize that chances are, things are going to get better and nothing's going to get worse.
So something that I've noticed, because as I mentioned earlier to you, cholesterol is something that's pretty dear to my heart, excuse the pun, but there used to be this whole kind of thinking that all the doctors kind of 5 years, 10 years ago, what was the total cholesterol? There seems to be a bit of a shift at the moment. Now people are wanting to know what the LDL is, the HDL is, your triglycerides. And my understanding is that a lot of the cardiologists now are looking at those particular risks. Yes, they might not be 100% on board with eating all the fat, but at the end of the day, it's not just about the total cholesterol. It's really about those ratios. And my understanding is it's particularly the triglyceride to HDL ratio. Maybe you could just elaborate on that.
Yeah, so I guess it all potentially plays a role. And so if your triglyceride to HDL ratio is good, then you're better off for sure. If your total cholesterol to HDL ratio is low, again, you're better off. And so some people will experience an increase in cholesterol on a low carb or ketogenic diet, but their HDL and their LDL are both going up. So what happens is the total goes up, but because the HDL also went up, the ratio stays the same or gets better. The challenge is, and particularly when people are interacting with their physicians, is that even with the much more nuanced way of looking at things, looking at ratios, looking at the breakdown and not just the total cholesterol, even so, the focus is still in the medical community on the LDL cholesterol, for better or worse. And so you can go to your doctor and say, look, I did this low carb diet, I've lost weight, and now my triglyceride HDL ratio is excellent. My total cholesterol HDL ratio is low, but if that LDL is still above a certain threshold, depending on your risk or the perception of that particular physician or cardiologist, then they're going to say, they may pat you on the back and say, that's great, I'm happy for you about that stuff. Now, I'm still worried about your LDL, and here, you need this medication to reduce your risk further. So even with the focus on ratios, there's still concern there, and it's not. I wouldn't say it's unwarranted. I was listening to a podcast recently with David Feldman, who we were talking about earlier.
Right.
Who writes a lot about cholesterol, and as I understand it, he's had a challenge where for anybody to give him research to show that there's still risk to LDL when the triglycerides and HDL ratios are great, and there's nothing out there, and I certainly don't know of anything. But that being said, anecdotal, N equals 1, I've had patients come in with heart attacks who had excellent triglyceride and HDL ratios.
Okay.
Their LDL wasn't even necessarily high, but it's so. I think it just speaks to the fact that it's complex. There's
Right.
a lot that goes into risk, and so a lot of it comes down to looking at, what is, and here's where I think nuance comes in, and is a lot of times is lost by people's physicians, which is that you really got to say, what is this individual's risk? So if somebody is at otherwise very low risk, their triglyceride HDL ratio may be great, they don't have a family history, they're active, they're not smoking, they're relatively young, then to go on a statin purely because your LDL or even your LDL particle count went up, that doesn't necessarily make a whole lot of sense because overall your risk is still very low. On the other hand, if somebody has a strong family history, certainly if somebody already has a history of coronary heart disease, the LDL may even be great, and I would potentially still recommend a statin because of that underlying risk, the plaque that is there or is presumably there.
So it's individual risk.
Absolutely. Yeah.
So if you could talk as a generalization now to the average person that comes into your clinic or to your rooms, and they have they typically on the standard American diet, and their cholesterol panel is not great, and you put them onto a low carb or ketogenic type of lifestyle. What is the typical patient? What do you typically see in those three ratios? And then one other question I'm going to throw in there. Do you, as a rule of thumb, always throw in the ultra-sensitive CRP as a marker specific to cardiovascular risk?
Yeah, so what I usually see happen in those ratios is typically total cholesterol to HDL will stay the same or get a little bit better. Triglyceride to HDL ratio will almost always go down. And so that's the usual thing that we see. And then what happens is they'll come back to me, and depending on whatever their LDL is, multiple scenarios. So we might say, you know what, your body's still changing. This is, say, a lot of the times is, let's stay the course and see what happens. Because heart disease doesn't happen overnight. It takes time, and so we have time to kind of let the body change and see where things play out. The other thing I might do is say, okay, well, with your next check, let's get a more detailed panel so we can see the particle counts and see what's happening there. And my practice is I don't do a particle count initially just because it can overly complicate things in my mind when a lot of times it's just not necessary. And so the one downside is that you don't necessarily have the baseline, but at least you can see where you are in terms of the risk there. And I order the high sensitivity CRP a fair bit, although it's seldom that's actually the deciding factor if I'm making a decision whether I feel like somebody should have a statin or an aspirin for risk reduction in addition to lifestyle change. I tend to use it more as just a marker and a benchmark for assessing where somebody stands in terms of their body changing and their improvement. It can be motivational. It's just one more thing to, it's nice. It's great to see things changing on the scale and body composition if somebody's purpose for making a nutrition change is weight loss. But it's nice to have other markers to look at, and the CRP is just one more thing. And I think for that reason, it's helpful to patients to be able to look at that and see that change. Although that change can be really, that takes a long time to get better. So for that one, in the first 3 months or 6 months, sometimes because there's a lot of noise, you may even see it go up before it goes down. If there's a fair bit of underlying inflammation. So I don't usually look at the CRP and say, oh, your CRP is up above 3 or 2, whatever. You have to be on medication right now, particularly because that's one where almost without fail, I can be confident that eventually that's going to normalize.
So if, for example, somebody presented with a high triglyceride count, a low HDL, let's say the LDL, a high triglyceride, a low HDL, and a benign LDL, let's say, but they presented with a very, very high ultrasensitive CRP, that would be an additional marker to look at?
Right, exactly, but so let's say they come back, and based on, if you sort of assess their risk as a point in time, when they come back and they clearly were able to make changes, and you're seeing improvements in the lipids and they're losing weight, and then the CRP comes back and it's still really high, I likely wouldn't do anything different, because this is somebody who's making changes. So that CRP, it's going to get better.
Okay.
It just sort of helps you know where you are now. And
just one more question before we leave. Where do you see cardiology going in the future? Do you see that we kind of winning the war? Do you think that we are losing the battle? Do you think that more cardiologists are starting to have this kind of thought process? Right. You've been doing this, by the way, for 6.5 years. This isn't something new for you. Mm-mm. Am I right? It's 6.5 years?
That's right. So I started treating patients in a more formal way for 6.5 years. It's been, I think, 7.5 since I've been counseling my patients, so even a little bit longer. So yeah, it's been a while.
This lifestyle, we're talking about this lifestyle, eating a low carb, ketogenic type of lifestyle.
That's right. And so, even when I started out in a practice of, at the time, 9 or 10 cardiologists. Some of them were about a decade older than I was. And so, if anything, you would think potentially even more steeped in traditional kind of dogma. Right. But the older guys in that group were some of my best referrers. And I think that it was because they were relatively open-minded, and they had the experience of not seeing results otherwise, and they were seeing me have results with my patients. And when I say results, partly I mean weight loss, partly I mean just results of having people successfully change. So one of the things I think to understand about physicians is that for various reasons, most physicians have had a long history of advising their patients to make certain changes and then seeing their patients not make the changes. And my take on that is a lot of it is because we've been giving bad advice. And so if you recommend somebody to do something like a low-fat diet that isn't really truly sustainable for most people, and then people don't do it, well, you shouldn't be shocked. But that's not the perception. The perception is I just gave you the best advice I know about, and you didn't do it.
Right.
And so why would I not treat you with medications? Because it's not like you're going to change anything. And that's the perspective of a lot of physicians. And so, but once physicians start seeing people make changes and stick to those changes, when they send you patients or they take care of patients that you've cared for that have implemented a low carbohydrate lifestyle and are doing well and having success, except for people who I would say have a dog in the fight, those the greater majority of physicians, they don't care all that much about nutrition. They're not overly committed to one thing versus another. They just want good results for the patients. And so if they see you getting good results, they're not concerned, right? And then your patient's cholesterol comes back high, and they go back to the doctor, and the doctor's like, you better talk to Dr. Thorn about this. I have a little bit of advantage being a cardiologist in this situation. But they're not antagonistic. Now, you have some people out there, doctors, not doctors, who they have a dog in the fight. They've been following a vegetarian lifestyle their whole life. Right. There's a lot that goes into that decision, and then they have certain opinions that then show up, and so I think that a lot of times when people get that sort of really kind of hard stop kind of antagonism from their physicians, it's because the physician has this really is focused on nutrition and has a different point of view. Right. That's going to be almost impossible to overcome. But otherwise, in terms of just where cardiology is going, I think that as more research comes out, as there are more of us practicing physicians, cardiologists or otherwise, who are treating patients, and then those patients are going and seeing other doctors and showing their good results. I mean, this is how Eric Westman got started. He had 2 patients who saw Dr. Atkins, and those patients did great, and he didn't have a closed mind. And so I'm optimistic that there's more physicians with open minds than closed minds. Sometimes it's hard to get their attention. They're busy. They're running around. They got a lot going on. But I think that there's a lot of potential for them to see good things happening and then get on board. I mean, my partners now send me patients, and they recommend to their patients, even when they don't send them to me, to limit their carbs. Now, granted, sometimes they're also saying limit their fats too, and I like to pull them aside and say, how exactly is that supposed to work? But But they're making the recommendation to limit sugars, to limit starches. And I even have one partner who absolutely does not follow a low-carb diet at all and is convinced that if he did, he'd lose too much weight. But he sends his patients to the diet doctor site.
Okay,
So,
well, that's a start.
yeah.
So, I'm going to put you on the spot. If you could give one bit of advice for people to adapt their life for the better, what would that be? You can take your time.
Okay, so one piece of advice to adapt your life for the better, it's to cut out sugar in any form except for the rare occasion and eat real food, which is to some degree the same thing.
I think that is excellent advice. Thank you so much. Maybe you can be our resident cardiologist. Maybe that's a thing. But thank you so much. Thank you.
Great. Thank you, Glenn.
Thank you.